upper blepharoplasty imaging from profile. Here we can see the patient picture that I have on the screen. I've already imaged a facelift, chin implant, and lower blepharoplasty on her. Now I want to image the upper blepharoplasty. This is going to take a little bit of work. I want to close my picture that's the original. I want to go to my picture that I'm imaging, and I want to hit the end button, which will zoom us into our picture and make it much easier to work on. Now, unless you have taken a picture on profile of your patient with their eyebrows raised, in which you can use your clone tool, just as I did from the front eyelid imaging. Unless you did that picture, you're going to have to do it this way. I'm going to start with, on my top banner, I'm going to click on Move and choose the Morph tool. I want to grab this eyelid area that's looping over the top of the eyelids. I want to grab that and pull it in. Now you'll notice when I made that box, I gave myself plenty of room to grab it and push it in. I didn't make a teeny tiny box. I made one that was a fair size, which you can do because you have zoomed into this picture. Now, here's my upper eyelid, and here's the skin that's looping down over the top. I want to push that skin off to indicate the actual eyelid. So I'm making a box, and I'm pushing that eyelid rim skin back. And we're exposing the area underneath that skin that's looping down over her upper eyelid. We're exposing it, and now we're going to make it so it actually shows. Now you'll notice I'm making a series of boxes, pulling up that skin. I tighten the lateral skin as well. Now I would like to go back up to the top banner, choose the brushes drop down and choose sizes to open up my toolbox. I'm going to go back to brushes, and I'm going to choose my tissue brush. Now I'm going to pull the intensity up just a little bit from light, not a whole lot. I want to still kind of be gentle with the application of color. I'm going to choose one of my smaller tool sizes, and I'm going to click down in this light area right outside of the rim of the eyelid, and I'm going to drag it into the area that is my new eyelid that I've exposed by pulling up that skin that was looping over the eye. Now I'm just sketching a little bit on the edge of the dark to soften the transition between dark and light. Makes it a little bit more natural looking. But you can see that I don't have my lateral rim. I want to draw a lateral rim. So I'm going to choose a smaller tool even. I'm going to click down in the area of dark, and I'm going to drag it down. You can see I'm just sneaking up on this. I'm not drawing a harsh, hard line. And I'm pulling it down in a natural angle. Okay, now let's take a look at what we have. You can see where there's a lot of light, bright color up here, and light colors come forward. It makes it kind of look like there's still a lot of skin up there. So I want to slightly darken this area just above my crease so that it doesn't look like the skin is looping over the top. I'm going to go back. I'm going to push my intensity down right underneath the T. I'm going to click down in one of my areas that is not as bright, but not super dark either, and just drag that color into that bright white area. So now it doesn't look like there's so much skin that's looping down over the top, but we still look like we have a ridge here, and I want to soften that. So I'm going to click down in the light area, and pull it through that darker area. Which is going to soften this whole upper eyelid and make it appear that there's no excess skin. It's all nice and tight, with nothing being droopy. Okay, so we're virtually done with that. I'm just going to soften this line that goes out laterally. Let's zoom out a little bit, hitting our end key, or excuse me, my home key. I'm going to arrange things so that we can see our changes. I'm going to go back up to View, and I want to look at my original picture. It pulls it up side by side. Close my box so it's not in the way. Now we can see where there was the skin looping out. We've tightened that up. There was our edge of our skin that was hiding the upper eyelid. We pulled that back and brightened up the upper eyelid to demonstrate where the natural rim would be. Tighten a little bit on that lateral rim of the eye, and the upper eyelid blepharoplasty from Profile is done. Let's go ahead and show our patient with the soft compare. Okay, I need to choose my picture first, and under the View drop down, soft compare, and we will open up that soft compare box and choose the reselect. I'm going to select the whole eyelid area. We've done the upper eyes and the lower eye, so let's go ahead and show our patient that change. So we tell our patient to watch the picture on the right. We go back to our soft compare box, touch the box. It's gathering all the information to morph that picture, and we move the box, and it morphs our picture with the soft compare to demonstrate to the patient exactly what areas are changing. Now, if I wanted to show this patient all of the changes that are made on this, I can go back to reselect, and I can choose everything that has been changed, including the facelift work. Go back over, oops, I got to set that down. Click it down. Go back over to my soft compare box, touch the bar, and it's gathered all the information, and then I move the bar across, and it slowly moves the work back to where the patient is originally. I can show the patient all the changes that were made on this picture. The more information that is within your reselect box, the slower the soft compare will move, the less smoothly it will move, but it still demonstrates and communicates to the patient the changes that you're trying to show. So there we are, demonstrating imaging of the upper blepharoplasty from Profile.